pain is gone.
Welcome to the office. Welcome to the office, ma'am.
Oh, thanks.
How can I help you?
I know that something's off. I know for a long time my muscles have been compensating, and
Okay.
from learning about you, I know foundation is off. You know, I've had a lot of head injury. When I was 2, I fell downstairs and split my head open. I had
On
a
accident,
scar.
right?
Yeah.
Okay.
By the time I was 8, I probably had 3 concussions.
Okay. You're off balance.
Mm-hmm.
You know that
Yes.
as a therapist, as a massage
Yes.
therapist. Top 3 things. Number 1 is
This
the
shoulders
neck and
neck.
shoulders.
Yeah,
Number,
that's affected my arms. I've been told I have carpal tunnel
okay.
and ulnar nerve damage in this one.
Okay.
Yeah,
And number 2,
lower back.
low back pain, stiffness, weakness.
When I wake up in the morning, it's always sore.
Okay.
Always sore.
And there's been no relief?
Mm-mm.
You just
No.
deal with it?
I've lived with it. I
You deal
don't know
with
what it's like not to live with that.
Okay. And number 3?
My mid back. I hurt my mid back when I was in the 4th grade in a
Okay.
swing set thing. I fell out of it and landed on my back, knocked the breath out of me, and that affects me. I know when I sit up, I even feel like right now, I feel like my head's going forward like this. That's exaggerated, but my head's going forward like this. When I sit down, I like to sit back and rest my back. But
There's a reason why.
Yeah.
And we need to talk about that today, don't we?
Yes, we do.
Okay, let's go
Yeah.
over your x-rays.
Mhm.
So the first thing we want to do, ma'am, is let's go ahead and look at the foundation. What do we have here? We have an AS5EX1. We can see a short leg on the right side. The measured difference is 9, so the right leg is 9 millimeters shorter than the left leg. Yep.
Mhm.
And the pelvis on the left goes up, AS5EX1. It's gone up and slightly out. But the idea, it's mostly up. AS up. If we fix your left pelvis, we're able to get the difference down to 7, which is the actual difference. In this work, we want the foundation to be under 7 for adjustments to hold. So check it out. Your foundation tilts on the right, and which way is your spine going to balance out?
Left.
So when we look at this leaning over here, these muscles and ligaments on the left side have shortened. These have lengthened.
Mm-hmm.
And that's going all the way to the upper back here now.
Mm-hmm.
Let's look at your tailbone. Not too bad, but we have a little old injury right there. It's very subtle, man. That's the tailbone, and that could be contributing to one or maybe even 2 millimeters of that hip being down. If I look at your L5, we're designed to have level parallel discs. 5 is about a 25-year-old injury. You can see this is kind of moving as a unit. This is an old whiplash injury. We can see the concavity or the indentation of the vertebrae in the front. We can see thinning of the disc there as well. So look, that's neutral.
Yeah.
That's extension. Ain't nothing down there moving.
No.
Your upper neck is moving, so I'm sure you get your pops and crackles going on up there.
Mm-hmm.
Inflection, it's just these top 3 that are moving. That ain't moving, that ain't moving, that ain't moving. Something is misleading here, ma'am, and I don't like it. Everything is coming from your foundation. 5 is off 4, 3, 2, 1.
Yeah.
12, hold on, follow my thought. 12, 11, 10, 9, 8, 7, 6. 6 may level off, but not really. 5, 4, 3, 2, 1. 12, 11, oh, did I say that?
Mm-hmm. Pretty messed up.
No, this is what's interesting. This is a whole different case than what I thought it was. So you may have something leveling off here, but not really. What I'm suspecting here, all of this from here all the way up, all of this is compensating from your initial injury. Was it the head that threw it all off? The head injury? Maybe. And so maybe we're going to have to deal with the upper cervical, or was it the low back? And why I'm saying that is your case is going to be a little different how we're going to deal with it. And let me tell you why. I'll find where the pressures are. But if we're trying to fix stuff, then what I'm going to do is I'm actually going to give you a few adjustments, and I'm going to re-x-ray you.
Okay.
I don't normally do that.
Okay.
but in your case I am, because
Okay.
this is a different case.
Yeah.
And because I'm not really finding the level, maybe at 6 it levels, but then it keeps going. So what caused what? Is it the tilted upper cervical, or is it the dropped leg? And that's what I want to find out with you, okay? This is a new case, guys. I don't think I've shared a case like this before. So why don't we get started? So she got a little dimple. We can see the right is lower than the left. You can see, like, basically from here, the whole thing goes over and then compensates like this, and that kind of matches on her x-ray. This crease is slightly higher, and she's also twisted, so she's twisted this way. All right, let's walk it out, lady. Let's see what you got. Walk on your toes, please. You see that little twist? So her dimples move a little bit. There's more side to side, that Wichita wiggle you got.
Yeah.
Yeah! We got a little bit of that Wichita wiggle going on. It goes up and down, but there's a little bit of wiggle there. Starting at the base. We got 15 points up top, right side. I'm a little suspect in your case here, though, man.
Well, good. I'm here for you to figure out something new and challenging.
So, you see it's sticking right side down the whole way, guys. This is cord pressure coming from up top.
As I sit here, too, my tailbone, and it feels more on the right side, I feel pressure.
Yes, ma'am. But what I'm saying is you got cord pressure up here. So before I mess around with any of this,
you got to go up top.
We got to go up top, man. Well, watch this. As we're running the fingers down the spine, the swelling is all here. Starts there around T2, T3. It goes the whole way down.
Not surprised.
All the way down. Now let's do the opposite side. Same thing. Same thing. Now the reason I'm checking the foundation, I'm actually going for the upper cervical. I just want to see if something changes after doing the foundation. Feet together, open and close the knees, open and close. Right side only.
Right side only.
Left side only.
Left side only.
This is coming from the sacrum, yo. Scoot back for me, please. S2. S3. How's that feeling to you, man?
It's all feels about the same. It's all tight and sore. S from 2 down. Oh, that's pretty spicy.
Tight. Yeah, that's spicy.
That's spicy.
That's S4, man. S4 on the.
Woo!
That's the one. You like that spice down in Texas?
Oh, I like spice, but not that spice.
S4.
Oh my goodness.
S4. Sit back for me. But here's the thing. This is what's going to be interesting in her case. I'm actually doing the upper cervical first. I'm not doing the foundation. And the reason why is the initial history or the initial trauma is a head trauma. And she has cord pressure going down the whole right side right there now. Look down, turn left. Let me do the work, please, sir. Look down and left. Look down and right. So just doing this, it's not happening from the top. She's compensating from down here. Look up, turn left, turn right. Look down, let me do the work. Down and left. Nothing's moving up here. It's all the movement's happening from here. This is all fixed from about C2 to C1 occiput. So the question is, what we gonna do, ma'am? We're gonna do the upper cervical, yeah?
Yep. I knew it was
So
coming.
your C2 is tilting right. C1 is. Yo. Alright, so the C2 is up on the right. And here's the misleading part. No snap. You got a critical atlas, lady. It's completely different than I thought. C2 is there. That's C2. And C1 is there.
Oh my goodness.
So C2 looks more elongated, but C1 on the left is actually more swollen. So this is a C2 right, C1 ASLP, C2 PRS. Completely different. Center on the chair, man. And then I'll recheck everything after. Center up. So here's what's interesting, again, I'm going to repeat about this case. I thought we were doing one thing, and it's very misleading. First, the overall presentation of the case, number one, and then number two is what we thought we were going to do, because we got a reading on the right, upper cervical. Hey, let's just crack an upper cervical. Yeah, that's not the case. So we're going to set C2 on the right as a PRS. We're going to do it very light. And we're going to hook, it's a bifid spinous. So I'm going to hook that right side of that spinous. You okay, man? Mm-hmm. Relax there, please. I'm hooking it. You feel that? Mm-hmm. Right there. Mm-hmm. And we need to lift it up. You got to give it, though. Don't fight me.
Distract me.
Nice and easy. What are you talking about?
You know. Texas
love? Mm-hmm. But I can't let go there. I got to keep going, okay? You're not giving it. Damn. And if that's the case, we may need to go. It's right there if you give it. It's right there. Happy place. You want to play? There you go.
Oh, awesome.
Now let's switch hands. Hi. You see? Check this out.
What? No way.
No way. But that's not it. That's part one.
No, but the pain is gone.
Oh. Now we want a soft pinch on that SCM right there. And this is an ASLP. So ASLP, we want to turn away, look down. Good. Relax there. Good. Relax that chin. ASL. Oh, no. One more. Oh, no.
Sorry.
That's all right. Let's go on the table over there. Left hand up. Gotcha.
Oh, you smart guy.
Yes, Upper cervical is clear.
Oh, awesome.
Now let's see what shows up. No kidding. So, we talk about the penthouse and basement, right?
Yeah.
And normally we're going after the basement first, aren't we?
Mm-hmm.
Well, today we had to do the penthouse, yo. That's crazy. And now we go for the basement, okay?
Goody.
But what I want you to tell me, if anything is different on the low back from what I did up top, come back slowly. Check it out. L5. S1.
That's way different.
S2.
Yeah.
S3. S4.
It's not as sore. It's still sore. But
It's there, but it's not the same.
It's not.
So her initial trauma was the head injury, upper cervical. Torque it up. Bring that chin up. Oh, it's ready. Oh, that's a little bit. That's a little bit. You ready? There you go. Give that a second. Cool. Bend forward slowly. Round your back and touch your toes. Drop the head. There you go. Sit up slowly. There you go. Deep breath in.
It doesn't hurt my back.
Guess what? You're all clear. No kidding. Let's recheck that upper cervical and low back. Back slowly towards me, man. 5. 1, 2, 3,
No pain.
4.
Amazing.
Really? 4. Head down, turn left. Head down. Ooh, now we're getting some movement from the upper cervical. Let's nod the head. Left side. Right side. No kidding.
And that doesn't hurt when you push down on my head now.
Like this?
Yeah, that always was a killer.
Sit up straight. Let's tune up the ears. Aye.
I didn't think you could do that.
Relax the shoulder. Don't help. Don't help. Don't help. There. On your back. Yes. There's your right leg. There's your left leg. They work really well even as a massage therapist. If you do it before the massage, it breaks up a lot of fascia. You can get deeper into the muscle.
That's incredible.
What's different as you're walking? Tell me.
I feel like I'm standing up instead of contracted. And I'm not slamming down on my right heel.
Yes, ma'am. Keep walking. She got her groove back. Let's see what happens.
I feel some movement in my hips.
You got a little movement. Yeah, and I didn't touch the pelvis yet, man.
No, but I feel movement.
Squeeze. Come closer. Don't be scared. Squeeze. Elbow. Posterior lunate. No. You crack your hands?
Not on purpose.
Scapula. Squeeze hard. There we go. Squeeze. Posterior ulna. Posterior lunate.
Oh, that's an owie.
Wow. On your knees, lady, hand on the table. You got too much
I
height.
haven't seen you do a board hand thing.
I have. So we're on posterior lunate. I gotta get quicker. There you go. There you go. There you go. Squeeze. There you go. Squeeze. The reason I use the... There you go.
Yeah, I can arm wrestle now.
Nice. The reason I use the board is I can go quicker into the adjustment, and the board will absorb the
Shock.
Squeeze. Squeeze. That's where we're going to start now.
Thank you!
Questions?
No?
You good?
Yeah. Thank you for the reset.
Welcome to the office.